In this part two of the series of degenerative retinoschisis and my nonprofit Degenerative Retinoschisis Society, we're going to use the homepage to continue raising awareness about this rare disease that is easily confused with the retinal detachment, and that you can be scheduled by many experts for a surgery that you don't need. If you have retinoschisis and your retinoschisis is confused with the retinal detachment. If you have not seen part one of this video, we recommend you to see that part one first. But if you haven't had time to see part one yet, let's comment again on what we're talking about. We're talking about degenerative retinoschisis. This type of retinoschisis is very common with the prevalence of up to 7% in normal person. It causes it can easily be confused with retinal detachment by the non-expert observer, and in difficult cases, even the expert may have difficulty differentiating the two. Such differentiation is important since retinal detachment almost always requires treatment, while retinoschisis never. Unfortunately, one still sees cases of uncomplicated retinoschisis treated by laser in an attempt to stop its progression towards the macula. Such treatments are not only ineffective but unnecessary risk complications. And again, there's always visual loss in the region of the schisis. So don't fall for the test that they convince you that you have a retinal detachment, asking you to count fingers on top of your head, and if you cannot count them, they convince you that you have a retinal detachment. That is not a valid test if you have retinoschisis. Going back to the homepage, our next step in the previous video was to show you this article from Harvey Lincoln and Ingrid Tracy, the misdiagnosis of retinoschisis, where we show confusion of the retinoschisis with retinal detachment does occur and results in unnecessary surgical intervention. And they show a 26-year-old male who was referred to the retinal service after 3 retina specialists. 3 had diagnosed bilateral retinal detachment and recommended urgent surgery. He was asymptomatic. In 2020, he was luckily spared surgery by a 4th opinion that diagnosed the patient as having retinoschisis. Another link for the web page is this one. Read why it is important for you to raise awareness about this. The importance of retinoschisis is that it can be misdiagnosed as a retinal detachment. And again, patients with degenerative retinoschisis need to know that they may have areas of peripheral visual loss corresponding to the area of the retina where splitting has occurred. But these areas of visual loss are almost always stable. So you see that test is not valid when you have retinoschisis. And let's go back to the page of the wonderful article from Annie Bayer. Introduction. Senile retinoschisis is still a poorly understood, mystifying entity. The fact that it is almost always without symptoms explains why most cases go without attention for the lifetime of the patient. This absence of symptoms has effectively prevented very many unnecessary operations by surgeons hoping to eradicate or control the disease. We cannot continue to rely on people not going to a doctor to avoid an unnecessary operation, because at some point during the lifetime, they'll have to go to a doctor, and then there'll be a schedule for a surgery they don't need, and then they can become blind from a surgery they don't need. Insurance companies, if a patient is 20/20 and no symptom, do not approve that retinal detachment surgery before you ask the patient to read his medical record to find out if retinoschisis is written. And do not sign for that surgery unless the patient is given reassurance that it's not a misdiagnosis of retinoschisis with the retinal detachment. Influential people of the world, tell it to your employees. Let's help raise awareness. This disease can be in 7% of normal people. Let's make this video viral. If we have 5 billion views 1 billion views. You know how many people will be aware of this disease and then will be able to stop a surgery they don't need by a doctor or 2 or 3 doctors confusing the retinoschisis with retinal detachment? Bill Gates, Sergey Brin, Larry Page, Jeff Bezos, Tim Cook, Elon Musk, Mark Zuckerberg, Jack Dorsey, Mark Cuban. Tell it to your people. Oprah Winfrey, Ellen DeGeneres, tell it to your followers. Cardi B, you are from the Dominican Republic like me and you have 27 million followers. Send this to your followers to save 7% of those people from a surgery they don't need. Sanjay Gupta in CNN. Elizabeth Cohen, you are a medical correspondent in senior medical correspondent in CNN. Let's put retinoschisis in the map. Let's feature this disease, degenerative retinoschisis, in CNN to tell the world that it's easily confused with the retinal detachment, even by 3 experts, like you have seen in the examples I have shown. Thank you. Another article is this one. The rate of detachment is nearly 0 by all these doctors: Margaret Chan, David Tripp, Robert Ecke, Adam Padel, Joel Peelman, Jay Bryan, David Talander, Tony Son, Robert Wengel. Look at the main point from that article. The risk of detachment without double layers holes is nearly 0. Back to the non-page of my nonprofit, another article, go back to my favorite one from Any Buyer, perspective of the management of the complication of senile retinoschisis. His conclusion: it is recommended that in cases of retinoschisis, either without or even with breaks, or retinoschisis with localized schisis detachment, that prophylactic treatment be withheld except in very few exceptional cases. Break is not a justification, and schisis detachment is not a justification. He writes here, it appears that no meaningful justification for treatment has been established. And another conclusion here. In surveying the broad spectrum of retinoschisis as it exists in the population as a whole, we may conclude that the best management, in summary, is to do nothing except in very rare instances. Back to the homepage for another article, the excellent one from this doctor, Diagnosis on the Line, Mark T. Dunbar, OD, where he puts the retina quiz for his colleges, and he demonstrates that retinoschisis combined with the retinal detachment was managed with observation only. So let's see what else he has to say here. Posterior extension is rare. So you see, there's nothing to worry about with retinoschisis. Another article from the homepage, this excellent one by Ali Saidi and Brandon Duhan. Combined retinoschisis detachment involving the fovea managed with observation. Retinal detachment may occur within retinoschisis. Despite foveal detachment, patients may maintain good vision without surgical intervention. This example is about a 61-year-old man who presented with 20/20 vision with a retinoschisis detachment. The detachment progressed to involve the fovea, and the vision declined to 20/40. Even with the vision declining, no surgery was done, only observation, and his vision remained 20/40. So it's like Any Buyer says, no meaningful justification for surgery. Another article from the homepage, from Institut de la Vision, degenerative retinoschisis can easily be confused with retinal detachment. Management. Surgery should be considered only in symptomatic cases that threaten the macula. Observation 6 to 24 months intervals. And another article uh, from Maine Family Eye Care, Marky Elkinson, optometrist. Actual progression of the retinoschisis to involve the macula is exceedingly rare. You see why it's important for you to know? And it is appalling when a doctor writes retinoschisis to the medical record and doesn't tell you, and then starts getting you with macula off stories. If your macula comes off, when your macula comes off, and all you hear is if you have a retinal detachment and if you have a macula off, and he never mentioned retinoschisis, so you don't know this good news that progression of the retinoschisis to involve the macula is exceedingly rare. Patients with retinoschisis should be educated. How can you educate a patient if you don't tell him his retinoschisis diagnosis and you only write it to the medical records? Patients with retinoschisis should be followed every 6 to 12 months if no symptoms are reported. Treatment of retinoschisis should only be considered in cases of symptomatic retinal detachment. Another article from Pramod Kirkar. What is retinoschisis? Let's go to what he says about treatment. Treatment is usually not needed for patients with degenerative retinoschisis. And the last article in the homepage. Spontaneous stabilization of symptomatic esquisses detachment by J. Donian, W. Pollock, and D. McLeod. Comment. This is the first report of symptomatic esquisses detachment that settled without surgery. We agree with Bayer that the appropriate management for non-progressive esquisses detachment is to do nothing, and believe this policy can be extended to symptomatic inferior esquisses detachment that do not involve the fovea. You have to be careful when you are 20/20, no symptoms at all, and you have 3 experts talking to you only about a retinal detachment surgery and none of them talking about degenerative retinoschisis. If a doctor is only talking to you about retinal detachment when you don't have any symptom and your vision has no change, you have to be very worried because you might be in front of doctors confusing your retinoschisis with retinal detachment. And the biggest danger of this confusion is illustrated by any buyer. Take a look at this. This is why you have to be very careful. Read this. It is also undoubted that the very serious complication of irreversible proliferative vitreoretinopathy (PVR) has occasionally occurred as a result of electing to treat asymptomatic retinoschisis, and that this complication has been underreported in the literature. Electing to treat your asymptomatic no-symptom 20/20 retinoschisis, facing this monster PVR, look, very serious and irreversible. When you say this word, irreversible, you have to be very careful. And it has been underreported. So, health governments, when are we going to report how many times this complication has occurred with doctors trying to stop retinoschisis from reaching the macula in an unnecessary surgery and risk complications? And how many people have gone through this unnecessary surgery in the world, being 20/20, perfect vision with no changes at all? That's why we need to raise awareness about this disease.